Many people think of hearing loss as a problem that affects senior citizens as they grow older, but newborn babies and young children can also have hearing problems.
Babies are screened at birth at the hospital. They receive a hearing screening, typically what's called an ABR or an otoacoustic emissions test. We have two different types of tests that the hospitals may run depending on how the hospital is set up with the equipment that they have. But both tests basically check the nerve structure in the ear to some degree. So it does give us an idea if the infant's hearing nerves are stimulated.
Dr. Kelly Pendrick is a hearing specialist with Audiological Services of Cadillac. She says that a small percentage of babies are born with hearing problems, but modern screenings can help detect those issues.
About 3 out of 1,000 babies have hearing loss at birth in one or both ears. Sometimes it's a permanent hearing loss, sometimes it's a temporary type of hearing loss. We can typically discover those hearing losses right away with the infant screenings that are done at the hospital. Typically they're done short time right after birth or prior to the discharge from the hospital. So usually within a day of being born, the baby's hearing is screened. Now if they pass the screening at that point and they don't have any other high risk factors, typically the hearing is not re-screened. If they pass the initial screening and they have any high risk factors for hearing loss, then they are typically screened for further hearing problems up until about the age of 3 years.
Thankfully, one of the most frequent hearing problems that children face can also be corrected with proper care.
The most common problem is middle ear pathology or fluid ear infections, however it may be termed. 5 out of 6 kids typically have some type of problem with middle ear pathology, fluid infections, by the time they're 3. So that is a lot of children, a lot of time. And the 0 to 3 year time frame, age range, is very important, critical for language learning. So a lot of language learning goes in there, yet a significant amount of children have temporary problems due to fluid in the ears, middle ear pathology problems.
Specialists such as doctors at Audiological Services are able to diagnose and treat a wide range of hearing issues that affect young children.
If the child has had enough ear infections, fluid problems that seems to not be able to be treated and successfully treated, they will then be referred into the ear specialist office, of which we are a component of that. We will do the testing, the hearing testing, check for middle ear pathology problems, and check the hearing, which helps with the ear specialist diagnosis and treatment of the problem.
There are also several things that parents and other adults can look for to determine if a child might have hearing problems. And the sooner those issues are detected, the better.
Any delays in language, if they do not seem to be talking well, meeting their milestones, don't seem to hear and understand you correctly, and a lot of parents will say, oh, they're just ignoring me, they're just being a 2-year-old. Well, it could be the hearing. Not all kids can tell you when they have ear problems or ear infections or their ears hurt, so they could go for quite some time before you realize they even have a problem. So if you are noticing any consistent problems where the child is delayed in speech, not hearing properly, not understanding you, not responding, it may be worthwhile to go to the pediatrician, get them checked there first, and then if they see that there is an issue that could potentially involve the hearing, they will refer over for a hearing test. I certainly would rather see parents come in and have their child checked and us find no problem than wait 6 months to a year and wish they would have had them checked 6 months ago because they've had this problem for so long.
For My News 26, I'm Kayla Kiley.